Does every small dog with a torn ACL need surgery? The evidence says maybe not. I'm about to say something that may get me kicked out of the orthopedic surgeons group chat. Not every small dog with a torn ACL, technically the cranial cruciate ligament, needs surgery. For years, we've treated cruciate disease almost as if surgery is an automatic thing. Tear the ligament, schedule the TPLO. And for many dogs, especially large athletic dogs, that's still absolutely the right recommendation. But what about a 9-pound Yorkie or a 12-pound Maltese or even a 14-pound miniature poodle? Should they automatically have surgery too? So a comprehensive review published in the Journal of Small Animal Practice, they looked specifically at dogs under 15 kilograms. One of the biggest conclusions surprised me. The authors state there's actually very little high-quality evidence identifying the optimal treatment for small dogs. Think about that. We have excellent studies in larger breeds, but we have often assumed the same recommendations apply to little dogs. And the review concluded that conservative management can be a reasonable option in carefully selected patients, although recovery is slower. On average, it's around 4 months. This actually makes biomechanical sense. Imagine a suspension bridge. If you double the weight crossing the bridge, the forces don't just double, they increase dramatically. The same principle applies to the canine knee. A Chihuahua simply generates far less cranial tibial thrust than a Labrador. Less force means less instability, less stress on secondary stabilizers, and a greater chance that periarticular fibrosis can provide enough functional stability. Small dogs also tend to have lower athletic demands, and many owners simply want their dog being able to walk comfortably around the house and through the yard and on neighborhood walks, not competing in agility. And this isn't a new idea. Back in 1984, orthopedic surgeon Peter Vassar reported that dogs under 15 kilograms frequently regained acceptable limb function without ever having surgery. Meanwhile, larger dogs had much poorer outcomes with conservative treatment. And that study really helped establish something that we still recognize today. Body size matters. Now, fast forward to 2024, researchers prospectively compared TPLO surgery with conservative management in dogs weighing less than 10 kilograms, which is less than 22 pounds. And here's what they found. Both groups improved. Pain improved, function improved, quality of life improved. The TPLO dogs did preserve muscle mass in that leg better, which is an important advantage, but from the owner's perspective, both groups experienced meaningful clinical improvement over the short term. And this is where people often misunderstand the research. Conservative management doesn't mean doing nothing. It means strict weight control, preserving lean muscle mass, controlled exercise, rehabilitation therapy, pain management when appropriate, maintaining that muscle mass long term, and allowing time for biological stabilization. It's an active treatment plan. It's not neglect. I think conservative management deserves serious consideration in dogs that are under 10 to 15 kilos, older or sedentary, have partial tears, or have significant anesthesia risks, or even owners who just can't pursue surgery. Those are exactly the patients where the literature suggests non-surgical treatment may be a reasonable choice. So here's my opinion after reading the literature. The question should not be, does every small dog need surgery? The better question is, which small dogs actually benefit enough from surgery to justify the additional cost, the recovery, and the anesthetic risk? Because the evidence today doesn't say every 10-pound dog with a torn cranial cruciate ligament automatically belongs in the operating room. It says the decision should be individualized, and that's what evidence-based medicine is all about.